Hello friends, welcome to LG Institute of Physiotherapy. Today we are going to learn about the fatigue. So fatigue, that means feeling of being extremely tired. That means it reduces our efficiency. It reduces the muscle power production during the muscle contraction. So this fatigue is a complex phenomenon that affects the muscle performance and must be considered in a resistance training program. And fatigue has a variety of definition that are based on the type of fatigue being addressed. So start with the muscle or local fatigue. Most relevant to the resistance is a phenomenon of skeletal muscle fatigue, and that means that in this the diminished response of muscle to a repeated stimulus and is reflected in a progressive decrement in amplitude of motor unit potentials, and this occurs during exercise when a muscle repeatedly contracts statically or dynamically against an imposed load. This acute physiological response to exercise is normal and reversible. It is characterized by gradual decline in the force producing capacity of neuromuscular system, that is a temporary state of exhaustion and leading to a decrease in muscle strength. That is here we are talking about the individual or group of muscles, and in that after the exercise or after the certain exercise, muscle will go for the fatigue, and after the fatigue level it won't be able to produce enough muscle strength or muscle power during the resistant exercise. And here we'll discuss about the factors that diminish the response of muscles, that the disturbance in the contractile mechanism of muscle itself because of decrease in energy stores, insufficient oxygen, and buildup of H plus, inhibitory influence from the central nervous system that can also diminish the response of muscle, possibly a decrease in conduction of impulses at the myoneural junction, particularly in fast twitch fibers. As we know, we have the two types of muscle fiber, that is a type 1 and type 2. So type 1 fibers are more resistant to fatigue than type 2. Next, the type of fatigue, that is a cardiopulmonary or general fatigue, and this type of fatigue is diminished response of an individual as a result of prolonged physical activity such as walking, jogging, cycling, or repetitive lifting or digging. We all are doing the daily activity, but after the prolonged period of the daily activity we feel some tiredness, we feel some the lack of energy, that is a cardiopulmonary or general fatigue, and it is related to the body's ability to use oxygen efficiently. And cardiopulmonary fatigue associated with the endurance training is probably caused by a combination of following factors. That means the decrease in blood sugar levels, decrease in glycogen stores in muscle and liver, depletion of potassium, especially in the elderly patient. Next, we'll discuss about the factors that influence the fatigue, a patient's health status. So, more healthy persons is more resistance to the fatigue than the poor health status persons. Then diet. Persons should take the healthy diet during the resistance exercise. Even lifestyle affect the lifestyle influence the fatigue. Sedentary or active, that means the active persons has more resistance to the fatigue. Means active persons has more capacity to the resistance to the fatigue. uh, Onset of fatigue is often abnormal in case of the neuromuscular disease, cardiopulmonary disease, oncologic condition, inflammatory and psychological disorders. Next is environmental factors such as the outside or room temperature, air quality and altitude, and also influence the how quickly the onset of fatigue occurs and how much time is required for recovery from exercise. Next, sign and symptoms of muscle fatigue. Start with uncomfortable in pain, then uncomfortable sensation in muscle, then pain and cramping, then tremulousness in the contracting muscle, then active movements. That means the not smooth but the jerky active movements, inability to complete the movement pattern through the full range of available motion during dynamic exercise against the same level of resistance gives of substitute motion, that is incorrect movement pattern to complete the movement pattern, inability to continue low intensity physical activity, and decline in peak torque during isokinetic testing. So, friends, today we have discussed about the fatigue, types of fatigue, that is a muscle or local, and cardiopulmonary or general fatigue, and basic factors influences fatigue, and sign and symptoms about the fatigue. So, thank you very much.